Sir is Professor Dr. N. Sridhar Shetty. Sir, please enlighten us about your journey in the education segment in Karnataka after you came back from your abroad mission.
Though I am a specialist prosthodontist, that is a specialty in the dentistry, but I have been in the medical field for a long time, since 1965 as a teacher and a practitioner and in the hospital working, and different parts of our Karnataka, that is Bangalore and Mangalore. And there, of course, I also had some experience in African universities. And I came back in 1995, and I was lucky to be given a chance to be the principal of A.B. Shetty Memorial Institute of Dental Sciences, founded by the NIT Education Trust. The founder of this NIT Education Trust is Justice K.S. Hegde, who was the leader of our Dakshina Kannada district, or even the national leader, being a speaker and a Supreme Court judge. His son and his nephew started a NIT Education Trust to start an education with the motive of education, employment, and health to reach the rural people. So I'm lucky to be, they were part of this NIT Education Trust, being a principal of the NIT Education Trust, A.B. Shetty Memorial Institute of Dental Sciences, a challenge for which I have to build an institution for the students to learn and come up in a life as a good, moral bound, duty bound, professional excellency doctors. So this was my ambition on which I started this venture of making a A.B. Shetty Memorial Institute of Dental Sciences, founded by NIT Education Trust. Thereafter, as I was interested with my previous experience in the Bangalore Victoria Hospital, where our dental college is present, even studying in the Bangalore College, a lot of thousands of people used to come by the carts and other things, sitting in the compound of the Victoria Hospital for weeks and weeks, and then they are not able to get all this one, and most of the patients who are coming are in the tertiary stage of the diseases, and now they were all going back with little help or no help, and this is how I have seen the tragedy which is happening, happening in the Victoria Hospital compound in those days, where all this because I thought that it is because of there is no facilities available for the rural India. So I came up with an idea as I started my dental colleges step by step to start. I started an idea that we should reach the rural people and we should provide all type of a treatment to the rural people at their doorstep. So as a dental surgeon, of course, I could succeed in doing all those things. But I came up, once the medical college also came up, I came up with an idea that many times people are saying rural people are suffering, they don't have facilities in spite of primary health centers, this, that, and all. See, actually in the medical science, what we have is the primary healthcare. It has been, for the convenience, primary healthcare, secondary healthcare, tertiary healthcare, and even the quaternary healthcare, that is an advanced transplant and other treatments. Now, it is possible that if we have a hospital in at least in the primary health center region area, where it covers about few villages, where it can cover 50,000 households of the rural area, we can do such hospitals in every primary health center area. It is possible that we could give all treatment to the people at their doorstep. At the same time, we have to have a people to go to house to visit for the community services, help them in a holistic approach to public health sensors, the balanced diet, environment, potable water, and all those things which can be made aware to the people how it is influencing the health. And at the same time, it can be done. Now it requires a big infrastructure. It requires a big manpower to all those things. So I come up with an idea that instead of having a medical colleges in the same campus, since we are all learning students into a small groups and putting them 6-7 wards, surgery 6 wards, medical 6 wards, like that, 12 clinical subjects. We are putting them in a different wards during second year, third year, and fourth year, and internship. Why can't we make this ward, instead of in one area, shift it, 5 hospitals, you make it in a different the radius of 250 to 300 kilometers, and then make it as a satellite hospital, 100-bed satellite apex hospital of the medical college. So you will have now little more expenditures for a diagnostic facilities and the infrastructure. Of course, you have to build it here. Instead of that, you are building there. Manpower is there in the medical college, that is shifted there. And students are there, they are shifted there. And everything will be for only our expenditure will be on the community medicine department, where we have to have a little more manpower to take care of this 50,000 households with the responsibility for them. I feel that today it is not possible for even a person, middle class person like me, to have many of the secondary, even the tertiary healthcare, forget about quaternary healthcare, because all with the research and other things, the medical, though it is advantageous for us to meet the various diseases with the good result, but things have become so expensive that one cannot afford. Even if you have a 5 lakhs insurance, health insurance for a person, it will not sufficient for many of the problems what we are going to have. So now, what I thought is this, since it's a medical college is supposed to have everything. So by shifting these people into the different areas and putting a responsibility of the 50,000 households of the rural area, I'm not talking about towns, cities, and other things, because the government has made arrangement, taluk hospital, district hospital, there are so many things are happening. Now, if the medical college shifts, it will be an apex hospital of 100-bed hospital, and with all specialists available in the hospital. For the tertiary quaternary care, you can definitely shift to them. Now, students will have a great advantage because a lot of populations will come to these places, because you are creating an awareness to them to come to the hospital. You are creating accessibility for the people to come to the hospital. You are creating availability of a treatment for the people to have it. And then, of course, I'm suggesting it should be free, affordable. It is possible with the medical colleges. Today, medical colleges I'm not saying they're not spending money. They are collecting the fees from the students. With that, they are building even corporate hospitals. You can see that our Manipal group has started a medical college in 1953. Today, they have divided their education into the corporate hospital also. So the corporate hospital today, they're number 1. It is because of the medical college. It is not because of something business or anything. So they can afford to do a free treatment with the support of the students only, And this 50,000 people should be given free treatment, and it should be the compulsory regulatory law should be made that it is compulsory for these medical colleges to take care of this 50,000 rural families register. With this, I think probably we can avoid the rushes in the big hospitals in the cities, and people need not wait there. They can still go to their work and work there, and all those things will be there. Now, recently, we read it in the newspaper, Dr. Sridhar, who is the health minister of our Karnataka, conducted a camp in Chikballapur. It made some London record or something record. We are read in the newspaper and hearing in the news and all. Good, excellent. But is these people are given a solution for their health care. If somebody wants a cardiac surgery, are they giving it free for them? If somebody requires a cancer treatment, are they giving it free for them? See, conducting a camp is good. That is, creates an awareness. You are saying that you are having a disease. But to take a treatment, whether that man can afford, whether he can travel up to Bangalore and take a treatment, time, money is all required for him. Since the hospital works from morning 8 to evening 4, I don't think he can reach the hospital even at 11 o'clock. After reaching there, he has to wait in the queue there. No, Dr. Sudhakar has done a great job. I have seen this type of camps and other things done through me, and there are so many of our colleagues have done or conducted all these associations have conducted. But this is only, I feel, it is a advertisement for the practicing doctors to make patients to feel that they are free. So you go to the private doctor and take a treatment. But many people can't take a treatment. So it's a good job creating an awareness for this one. But these camps should be accompanied with a free treatment. Free treatment, free conveyance, everything. Then I salute Dr. Sudhakar for creating this great history.
Thank you very much, dear sir.